Our next segment is about varicose veins. We hear from our viewers all the time you want more information on this. So Dr. Marjorie Dixon is here to tell us what they are, why they form, and what we should do about them. So Marjorie, let's just start with what are they?
So varicose veins are dilated superficial veins under the surface of the skin, and they are discolored. They're deep purpley blue. Sometimes you can feel them, they're palpable. Most of the time they don't cause people too much trouble symptomatically, but they're just really unsightly.
Is there ever a time that you should actually go see a doctor about your varicose veins?
Yeah, so most of the time, as I said, it's more of a cosmetic thing. Women, they are more likely to happen in women, and so they want to just deal with them because they don't like the looks of them. But there are times where they can be problematic, and the few times where your varicose veins need to be dealt with is if they are really painful. So if they're hot to touch or they're bright red and they cause you pain, that shouldn't happen. That's called phlebitis or superficial phlebitis, inflammation of the swollen veins. Another time that they need to be dealt with is if it's down to the ankle and you develop an ulcer associated with them. That's just because you're not getting enough blood flow away from the area, so that needs to be dealt with. Or if you have big bruising or bleeding around a varicose vein, that also you need to seek medical attention in that regard.
Okay, good to know. What are the actual risk factors for getting varicose veins?
You really are predisposed often. One, age, so the older we are. Because of the fact, the reason why these vessels get all dilated is because, you may think about acid reflux, where the acid goes back up into your esophagus, it burns. It's venous reflux. So what that means is in our veins, leading the blood back to our heart, the valves are supposed to come together and push the blood back against gravity to go back to the heart to get oxygen again. When those valves don't work very well and you have faulty valves, then the blood pulls back. So it flows back through the valve and then the vessel dilates. So that's why they call it venous reflux disease. And as you get older, like other things, your valves don't work as well, so you're more likely to get it that way. If you're a woman, you're also more likely to get them because of the hormones that you get exposed to, particularly in a pregnancy. So women are more at risk, and every pregnancy you have, it can get worse. But the good news is generally after a pregnancy, within 3 to 12 months, the vessels should return to their baseline. Also, if you are inactive, you're more at risk because your calf muscles are needed to squeeze the vessels to get the blood to go back to the heart again. And then if you are obese or heavy, because there's more pressure on your lower limbs, so the blood pools.
Is there anything you can do to prevent them?
Don't wear tight-fitting clothes around your waist or your abdomen. That's one of them. Exercise, because the deeper veins that actually push the blood back to the heart are inside of the calf muscles in the lower extremities, so more exercise is good. Don't wear high heels, because when you wear high heels, that also extends the calf instead of allowing the calf to put pressure on those vessels again. So wearing flats is better, which is so sad for fashion. If you are standing, if you have a job where you are stationary, like a surgeon in an operating room where you stand in one spot for several hours, you can also wear compression stockings on the lower limbs, so that will, on the calves or on the lower legs, that forces the blood back to the heart as well. So those are some of the things. And if you have them also, when you get home, put your legs up because you're, helping gravity.
And then what about management, or at least minimizing the varicose veins? What can you do?
So there's something called sclerotherapy. So there's spider veins, which are kind of they look like spiders superficially. They're much smaller. Those can be managed with something called sclerotherapy. So it's an injectable solution that causes the vessels to close up and be smaller. That's one. Then there's also laser, superficial laser. Again, for the smaller superficial ones, you can do laser or radio frequency, and that will cause the vessels to collapse and resorb. The bigger ones, like the ones that I was talking about that are unsightly, that people don't like, you've heard probably of vein stripping. It's a little bit better now. They do phlebectomy, so they take it out in pieces. When I was a resident, I remember seeing that surgery and thinking, I am never getting that surgery, because they do 2 incisions, one at the top, one at the bottom of the dilated vein, and they pull it out. It's day surgery, but it looks pretty barbaric. Now they have something called saphenectomy, where phlebectomy rather, and they take little bits of it. Also day surgery, little incisions. It's not painful at all, and then you get that faulty vessel out little bits. There are a lot of different ways of managing it. And then it returns to normal. It's actually quite shocking, the before and afters, when you've seen people have really bad veins and then go to have that treatment and management.
Interesting. Okay, so there's a lot of options out there if you're willing to go through it and maybe go through a bit of pain. You can get that done, but obviously hang out with your physician and figure that out. Marjorie, thank you so much for that. Good information.
Yeah.